So, as an organization that focuses on supporting students experiencing homelessness, Bruin Shelter realizes that in order to promote effective social justice advocacy, part of this is becoming more thoroughly educated on the issues that affect us and our community. So, through this event, we want to shed light on how the ongoing pandemic has exacerbated some of the issues faced by people experiencing homelessness and how it's put many more at risk of housing insecurity. So again, through this event, we hope to characterize the disproportionate effects of COVID-19 on individuals experiencing homelessness, along with some of the general disparities observed among our unhoused neighbors. And we have some experts and community leaders, both from UCLA and some social service organizations, here with us today to help us out. And I want to extend a really warm welcome to our speakers for taking the time out of their day today to share at our event. All right, so our speakers for today are Dr. Randall Kuhn from UCLA's Fielding School of Public Health. Dr. Kuhn is a demographer and sociologist who studies the social determinants of health, immigrant health, and homelessness and global health. Next up, we have Jessica Richards from UCLA's Fielding School of Public Health. Jessica is a doctoral candidate in the Department of Community Health Sciences at UCLA Fielding School of Public Health, and her research examines health and homeless trajectories among young adults in the Los Angeles community. Our next speaker is Vicky Arenas from the People Concern. Vicky oversees communications and external affairs from one of LA's largest housing and social service agencies, which is the People Concern. And we have Professor Blasi from UCLA School of Law. Most recently, he's published research papers on the impacts of COVID-19 on low-income and BIPOC communities. And he co-directs an extensive effort to create an online eviction defense tool to help tenants defend themselves in eviction cases. All right, and unfortunately, one of our speakers, Andrew Lewis, just informed us that he's feeling very unwell today, so he's unable to join us for today's panel. We'll really miss him and his expertise, but we're really grateful to have this wonderful group of speakers still here with us today. Cool. So some of the panelists have prepared some slides to share with you all, and at the end, we'll dive into some questions that we have prepared for our wonderful guests. We'll open up the Q&A to you all at the end of the event, so feel free to send in any questions you have in the chat. You can also private message me in the chat as well. And we kindly ask you guys to stay muted throughout the panel, just out of respect for our speakers. And we can get started with our event. So first up, we have Dr. Randall Kuhn, followed by Jessica Richards. You can feel free to get started whenever you're ready.
Hi, everybody. I didn't realize I was going first, but that's great. Let me just make sure my screen share is working. Here we go. Great turnout. This is awesome. Can everyone see my slides? Yes, cool. So great to be here. There's a lot that I could talk about, and really there's a lot that I'd like to hear and learn about Bruin Shelter and about student homelessness and at the university level. And Jessica will provide some background on that, but I thought I would mostly start today off by just talking about a little bit of an overview of where we're at with homelessness in LA County, and then focusing specifically on vulnerabilities in light of COVID-19. So just as a little, went off mute. Just as a little background, the 2020 homeless count suggested that there are about 66,000 homeless people at any given time in LA County. We should take those numbers with a grain of salt. I'm actually part of the team that's trying to set up the 2021 count. It's a kind of a challenging and error-prone exercise to count every single homeless person in the county, especially when you don't know exactly, you're not sure what the definition is. Either way, whatever the numbers are, about 3/4 of the homeless people in LA County are unsheltered. And that is very unique. Even throughout the West, it's pretty high percentage unsheltered, but even relative to that distribution, 3/4 is it's quite a large and daunting number. And one of the things that we're really focused on is, what does it mean to a person experiencing homelessness to be unsheltered? In general, I think we can say some of what it means is, like other people experiencing homelessness, and I'll just start saying PEH. That's a sort of acronym that I use a lot for people experiencing homelessness, right? That you are highly dependent on what we call congregate services, right? Group services, whether it's soup kitchens or medical offices or whatever it might be. At the same time, you're often isolated. So one of the questions I had at the start of the pandemic was, in fact, given how COVID-19 is related to social interaction, was it at least possible that homeless people, although they have many, many times higher risk of many chronic and infectious health conditions, was it at least possible that they wouldn't be as vulnerable to COVID, or wouldn't be any more vulnerable than others? Because as I said in this one LA Times piece, I'm quoting myself, which is bizarre maybe, but I like the quote. So social distancing is what everyone already does with homeless people, right? So if people are avoiding you, they're not likely to transmit COVID to you. In general, in terms of vulnerability, PEH are younger than the average American, but the average American is quite old, as probably many people are maybe aware, right? This country is aging quite rapidly. So we have a large share of our overall population who are 65. Relative to that, the larger group of homeless people are between 55 and 65. And they are, right, it's the same cohort, the same group of people born 1955 to 65 dominate the homeless population. And so with each passing year, that group gets older and older. And so homeless people are getting older over time. And more importantly, long-term homelessness, the physical insults and the traumas that entails, often create a process of accelerated aging. So someone who is homeless and is 50 may have the physical vulnerabilities and chronic conditions of someone who's more like a 60 or 65-year-old. So right after the COVID-19 pandemic began, a group of colleagues and I, led by Dennis Culhane at University of Pennsylvania, put together this report that basically tried to say, we don't know what the transmission dynamics are, right? That homeless people might be vulnerable to group settings, but they also might be isolated. But one thing we did know, that we felt that we knew, was that if they got COVID-19, that homeless people were going to have more complications than than a non-homeless person of the same age, because they have so many vulnerabilities, so many other physical, what we call comorbidities. And so we developed a very simple, crude model. It took about 2 days to put together, that suggested that COVID-19 death rates among PEH could be 3 to 4 times higher. And on the basis of that, we basically put together a case initially for just some kind of solution, but very quickly, thanks to folks like Gary Blasi and others, it became clear that the solution was hotels, that with all the hotels being empty because of COVID-19, because of the shutdowns, there was a unique opportunity. In my mind, it was a unique opportunity not just to protect people who were vulnerable in hotels, but also to put hotel workers back to work. So it never quite materialized in quite that way. So our report was led to the CARES Act, the federal COVID recovery bill, included a lot of money for homeless funding, which was quickly sort of allocated to a number of projects, but particularly to projects aimed at placing people in hotels. So a lot of people may have heard of this Project Room Key, was this statewide program to protect 15,000 people in hotels statewide that expanded in LA County to be a program aimed at putting 15,000 people just in LA County. That was basically enough hotel beds. The plan was enough hotel beds to take every homeless person over age 65 and anyone, and pretty much anyone age 55 plus, and anyone else with vulnerabilities, and basically protect them in a hotel and also reduce the density in wherever they were before they moved into the hotel. The progress was really exciting initially, but it kind of petered out, largely because hotel owners are, well, I don't want to get into it. There's a lot of reasons, but certainly the main one being a lot of people didn't want homeless people in the hotels in their neighborhood, but mainly hotel owners didn't want their brand associated with homelessness. And so it maxed out at about 4,000 people, which is still pretty impressive. We also know that for a variety of reasons, again, some more nefarious than others, Project Room Key did not just target the average homeless person in LA County. So this graph basically suggests that white homeless people were quite a bit more likely to end up in Project Room Key than people of color. And so that was quite a challenge, quite frustrating. So in the end, right, Project Room Key didn't do all that well, but the good news is, again, this is in a world of mostly bad news. Rates of COVID-19 infection and mortality among homeless people in LA County are about identical to those of the general population. And that counts as good news, that in a world where, again, homeless people are often 10, 20, 100 times more likely to have conditions like, 25 times more likely to die of overdose, orders of magnitude more likely to have hepatitis C. That in that kind of a world, the fact that homeless people are merely no more or less likely to get COVID-19 or die of COVID-19 so far counts as good news. The bad news, really bad news, is that in spite of the fact that COVID-19 hasn't hit the homeless population too terribly hard relative to our expectations, the number of deaths among homeless people is continuing to rise. And that is, deaths on the street among homeless people have been rising about 10% every year for close to a decade. This year, they're rising even more than that already accelerated trend, which is that it's between 20 and 30% increase relative to the previous year. So that would be about 200 extra homeless deaths, which again, only about 50 of those can be attributed to COVID-19. So even as we're doing a reasonably okay job, perhaps, it's probably more just luck in protecting homeless people from COVID-19, people are dying either due to unreported COVID-19 or more likely due to conditions related to the frustration and depression and isolation of being out on the streets during a pandemic. So there's a lot of other concerns that I could throw out there. There was just a great report issued on K-12 homelessness. We need to talk about permanent housing. I think our colleague from People Concern will talk more about that. We have a report that Jessica also was one of the co-authors of that talks about all the things we need to do to improve programs and systems. So we'll talk about that later. But for now, I'll transition into transition age youth homelessness and pass it over to Jessica.
Thanks so much. All right.
And Jessica is my student, but I'm not grading her.
Thank you for that. Okay. Can everybody see that okay? Thanks for bearing with me here for a minute. Okay. Can you guys see my slides? Or you see my notes?
Oh.
We can see your slides.
Cool. Okay. So thanks so much for having me. I'm really excited to be here. And today I'm going to be sharing some findings on housing insecurity among UCLA students during the COVID pandemic. So to give you a little bit of background, I conducted a qualitative study. The idea was to explore underlying patterns of homelessness and housing insecurity among UCLA students. I did this by partnering with RISE, which is a nonprofit student organization. They helped me screen and recruit students. During the spring, RISE surveyed over 700 UCLA students. Survey results indicated a cumulative pattern of housing insecurity at UCLA, with 2% of students reporting an episode of homelessness in their first year, and then rising to 9% among students in their fourth year and higher. So survey participants who indicated a history of housing insecurity and who were interested in participating in advocacy efforts to end student homelessness at UCLA were invited to participate in this study. And I conducted 13 one-on-one interviews, and these are key takeaways from those student experiences. First and foremost, student housing security was often tied to the quality and strength of students' family housing. So for those with a safety net to fall back on, financial and family considerations were major factors in deciding to move home. For some, the cost of living in LA was simply too high when they were unable to really take advantage of the area. Although another acknowledged that my family situation isn't the most stable, but it's stable enough to live here. Housing, of course, is prone to change. Moving home can improve housing stability, but it may worsen if, for example, a parent loses their job. For those with the greatest housing insecurity, options were limited. As one participant explained, I knew that moving back home would be an unsafe environment for me, but I really didn't have any other choice. The perceived risk of contracting COVID has directly influenced housing for students. For example, one student, she avoided going home because she had a family member who was high risk. Another was kicked out because her mother didn't want too many folks at the home. And another chose to shelter in place with her partner rather than stay in a house with multiple roommates. Certain UCLA administrative decisions have exacerbated housing insecurity for some students. One student described how his roommate had left UCLA because his research funding was cut, and now it was up to him to find a replacement, or he had to cover the rent on his own. Others are concerned about deep cuts to financial aid. 2 housing insecure students shared that their financial aid packages were cut, one by $7,000, another by $10,000. And both had planned to use this money to pay for rent, and neither were able to obtain all the documentation needed by the university to receive financial aid. One student living with her boyfriend and splitting the rent shared with me that it's just really stressing me out because I'm not on the lease, but you need to submit a lease agreement to get more financial aid. I feel like financially, I'm not getting help from the school, and it's frustrating. Most students express that housing is a source of anxiety in their lives. As described by one student, it's always that looming thing in the back of my mind. How am I going to pay the rent? How am I going to get enough money? Another said his housing status makes him sad sometimes. It's definitely very socially isolating. Regarding mental health services, one student who is now receiving telehealth care through UCLA expressed that it's been really helpful and that a lot of her anxieties have to do with the weight of housing. Though access to mental health was an issue for a recent graduate, she acknowledged that while she had access to services, they were really helpful, but that she lost her health insurance when she graduated and now she's no longer able to see her doctor. Another did not find counseling helpful because, as he explained to me, I know they have mental wellness services and everything, but those people, they don't know. They don't understand what we're going through. I will say one silver lining is that COVID has essentially eliminated commuting. This is really significant because most participants were super commuters. I'm talking about up to 3 or 4 hours commute one way. And these commutes were described as both mentally exhausting and physically painful. So although working remotely has been a perk for some, this is likely to be temporary relief as students will return to their commutes once the pandemic is over. In closing, I'd just like to underscore that this is not a representative study due to our sampling frame. And in particular, none of the participants that I interviewed currently identified as homeless. And so we would really welcome other perspectives to help us develop a better understanding of how UCLA students are experiencing housing insecurity. Thank you.
Thanks, Dr. Kuhn and Jessica. I think those numbers were very surprising to hear and nice to be aware about. And as well as the testimonials, I think they shed a broader light on some of the issues related to student homelessness. So thank you for that. So next up, we have Vicky Arenas from the People Concern. You can feel free to share your screen whenever you're ready.
All right, 1 second. Can you see it if it's full screen? Okay, great. So I'm Vicky. I work for the People Concern. For those of you who don't know, the People Concern is one of LA County's largest housing and social services agencies. We are the product of a merger between two organizations that took place a few years ago. And so now we have over 600 staff and teams all across Los Angeles County. We provide a holistic model of care. So we have teams outreaching to folks on the streets, wherever they are in the community, all the way through to permanent supportive housing. 92% of the people that we place in permanent housing are never homeless again. So we are very thrilled about that because the goal is, for us, it's not just about getting people into a home, it's about keeping them there. So I won't go through all of this as it was already touched on a little bit, but one thing I do want to point out, in addition to the rise in homelessness, is that as a result of the pandemic, there are some studies out there that are predicting up to a 20% rise in homelessness in California. Obviously, we as a provider, and I think everyone on this call and beyond, is very, very hopeful that that will not be the case and that we are, going to have some sort of safety net for folks who are very housing insecure to prevent them from falling into homelessness. But that is something that's out there. So I just wanted to point that out, that these numbers are reflective of the count that took place in January of this year, so prior to the onset of the pandemic. The other number that I want to point out is that Black people in Los Angeles are overrepresented in the homeless community. So Black people make up only about 8% of the county population, but nearly 34% of the population of people experiencing homelessness. And in our own organization, about 40% of the people that we serve identify as Black. And so, of course, this is not by accident, right? This is the product of racism and systemic inequities that have been present and prevalent in this country for generations. And so we need to recognize that and understand that we need to really implement policies upstream that promote and create more equity in our society all across the board, because that has very direct implications on the social determinants of health for this population, for all populations. And so specifically as it relates to COVID-19, we know that BIPOC communities are disproportionately impacted, right? We also know that about 17% of Black people are essential workers in this country, while they only make up about 12% of the country's workforce. And so there are some numbers out there, and I'm not a researcher myself, so I got these from, I think, credible sources, but the average life expectancy of people experiencing homelessness could be as low as 50 years of age, which is about 20 years shorter than people who are not experiencing homelessness. But I think the bigger thing to point out here is that so many of the people that we serve have trimorbidities, right? So not only comorbidities, but trimorbidities. So that includes a chronic health condition, substance addiction, and mental illness. And so poor health contributes to homelessness and is exacerbated by homelessness. And so these three men that you see are all program participants. This is Lennart far left, Benjamin in the middle, and West on the right. These are all folks who have had severe health conditions. One of them has had cancer, one of them suffered from a stroke that directly contributed to them falling into homelessness. And so it's really important to make those connections. And of course, it's incredibly difficult for people on the streets who are unsheltered to have any kind of regimen when it comes to taking medicine, or if they're diabetic, keeping their insulin cool. All of those things are virtually impossible and are made that much more difficult during the pandemic because, as Dr. King mentioned, so many of the congregate spaces that were previously available, even like going into a Starbucks to clean up or going into a library to charge your phone, all of that is really not an option for folks on the streets anymore these days. So another piece that I want to touch on is the lack of affordable housing in LA County. We have a very significant shortage of affordable housing. And, you know, if we could just stop the inflow of homelessness, we have about, according to Los Angeles Homeless Services Authority, we have about 227 people who are falling into homelessness every single day. And that looks different, right? That's not necessarily that people are literally out on the street in an tent by the end of the day, every day, but it's folks who are couch surfing, it's folks who are living in their cars. So if we could just stop that inflow, we could really solve the issue. And we know that housing, as I mentioned in the beginning, it's not just about housing, it's also about the additional supportive services. So housing and supportive services solve homelessness. So a little bit about, I already touched on a bit about how COVID-19 has impacted people experiencing homelessness. And for our services, we've continued to remain on the front lines, providing pretty much all of our essential services. So street outreach, our interim housing sites, but they have been decompressed. And so we have this heightened demand. We've got people who are really desperate for basic necessities, like access to showers, to food, to hygiene supplies. And so in the beginning, we were also, just like most providers and companies, struggling to procure enough personal protective equipment, right, to distribute to our folks living outside so they can stay as safe as possible. And we did operate Project Roomkey, so we were involved with that project as well. And we moved some of our folks from both people that were connected to our outreach teams and people in our interim housing to Project Roomkey hotels, and have had, you know, those folks are definitely in a much safer environment when it comes to the vulnerabilities that they have with their health. So, so again, we've remained operating, and something that was really unique for our team is that our outreach teams have now tested thousands of people. And so that's been sort of a new, I guess, service that we've offered, right? It's not just about linking people to resources and housing, but now it's also educating people about this pandemic, this public health crisis, and also providing them with testing. So we're very grateful to support from our community. Bottom right down here, this is Nito and Matthew. There are two of our program participants who are married. This is the first time that they're spending some time together inside, sheltered. They are at a Project Roomkey hotel and moving into housing soon. They have a voucher, so we're very, very excited to see where their journey takes them next. And some involvement opportunities. So I wanted to touch base on a few advocacy opportunities and just general involvement opportunities for anyone that's interested. So Measure J is a ballot measure that the people concerned is endorsing. And there are some volunteer opportunities around that, including phone banking and text banking. I've included a link there as well. We, of course, need more permanent housing, permanent supportive housing. You know, housing and health are so linked, and it's housing first, right? But it's also housing always. And so we need those key supportive services to keep our neighbors housed for good. So you can find some information on how to get involved, sign petitions, and advocate. And then CARES Act funding. We do need to continue to ensure that people who are at risk of falling into homelessness, as well as those who are currently homeless and victims of domestic violence, are included in this funding and in these priorities. And then our outreach teams, like I said, connect with about 5,000 people annually on the streets of Los Angeles. And we are always looking for hygiene kits, cases of water, granola bars, new socks and underwear, gift cards to access food. So if anyone's able, please do, but definitely advocate. It's really important. I think more than ever now, we're seeing that policy improvements and changes upstream are really, really key to creating and promoting more equity in our society and to solving homelessness. So thank you. Our contact info is right there. And that's all I have for you. Thank you for listening.
Thanks, Vicki. That presentation was amazing, and it's awesome to see what services you guys are providing, as well as like some opportunities for us to get involved too. So thanks for that. All right, so the next speaker that we have up is Professor Blasi. You can share your screen, or you can get started whenever you're ready. Sorry about that.
I could share my screen, but it would be quite boring. I didn't do a PowerPoint pack, so you're just going to have to look at me, I'm afraid. I want to start by talking about what's going to happen in the next few months. And then I want to talk about mainly the reason that I've agreed to and was invited to talk about, which is racial and other disparities in homelessness. As bad as things are, they're about to get much worse. Evictions have been frozen basically since the pandemic began. Evictions are going to begin en masse on November the 9th. And in May, I did a study that estimated then, based on unemployment numbers, there were 365,000 households in LA County that were at high risk of eviction. In August, the Aspen Institute did a study with different methodology, estimated about 600,000 people at risk of eviction. They won't all become homeless, but a very large percentage of them will. So what we have been seeing in terms of inflow is going to get much, much worse. So turning to the question of disparities, when LA released the homeless count in January, it was said that Black people were 4 times more likely than non-Black people to be homeless. And that was basically comparing those percentages. I'm not a statistician. I'm a person who talks to juries and other folks, try to explain things. I think a much more useful tool to do that is to look at what the odds are of someone having a particular situation. And the fact is that in LA County, the odds that a Black person is homeless are 10.4 times the odds that a white person is homeless. 1 in every 40 Black people in LA County is homeless. More than 1 in more than 400 white people is homeless. Some other odds ratios, statisticians call them. The odds of Black people in LA County dying are 3 times those of whites. For Latinx people, it's 2.5 times. The odds of being unemployed during the pandemic have been 3 times as high for Blacks as whites. And the inability to pay rent has been 3 times as high as for whites. So in one way, there's probably no other social problem that reflects more starkly the cumulative effect of long-term systematic discrimination and also the current operation of bias and prejudice, both explicit and implicit, that leads to this incredible disparity in what is the cumulative effect of all of those things, going all the way back to slavery to how people get into Project Roomkey, for example. That doesn't mean necessarily that we have to solve racism in order to end homelessness. The way you end homelessness is you offer, and this is in the overwhelming number of cases, you offer people access to something that's better than where they are that constitutes housing. You offer them a room with a door and a key and a roof and some privacy, some autonomy, and some dignity. And overwhelmingly, people will take that without any police encouragement. The problem is that we haven't been able or willing to make that offer to people. But if you want to end homelessness, that's all you have to do. You just have to come up with alternatives and make them available to people. If we did that, if Project Roomkey, now what's called Project Homekey, had been much, much bigger, we might have ended visible homelessness among a significant number of people, but we didn't do that. But if we had enough hotel rooms, we could house a lot of people and make some dent in actual homelessness, but that wouldn't end homelessness because the processes that are producing extremely poor people who have very little chance of being able to buy housing in a society where housing is a commodity. Those processes haven't changed at all. And they've, in fact, gotten worse over time as the housing market has gone insane. If there's a competitor to homelessness as a racialized social problem, I think, as we know from the now seemingly not much talked about racial discrimination and criminal justice that drew so much attention following the murder of George Floyd, criminal justice would be probably right up there with it. And criminal justice and homelessness have a lot to do with each other. Involvement in the criminal justice system is a high predictor of homelessness. It makes it harder to get a job. It makes it impossible to get some housing. And it's also a consequence of homelessness. Virtually nobody who's been on the street for any period of time, I'm literally on the street, has avoided having a citation or an arrest. And those things begin to accumulate, and they take a toll both in your ability to get a job and on your mental health and your ability to maintain a job, to have an education, and so on. So it's important to situate, I think, homelessness, the things that produce homelessness, and the ways in which those things are heavily racialized and also prejudicial and stereotyped and other dimensions, but particularly with respect to homelessness and with respect to race. I think it's really something that we should constantly keep in the forefront of our mind. I know we want to get to the Q&A, so let's do that.
Thanks, Professor Blasi. Thanks for your insight and expertise on those topics. So actually, Andrew was able to join us. If you want to introduce yourself and say a little bit about LA Tenants Union, that would be great.
Sure. Did you want me to go now or later?
Yeah, you can go ahead.
Okay. I didn't want to cut off that great presentation from the professor there. Hello all, sorry I'm running a bit behind. I literally had to go get a COVID test because I wasn't feeling well today, and didn't know if I was in the right capacity to come, but here I am either way, so hopefully this makes sense. But glad to be on, and this is a very important topic. As mentioned, I'm one of the co-founders of the LA Tenants Union Westwood Local chapter. I'm a renter here in Westwood Village. So we are a local union that represents the area, predominantly student renters, UCLA students. You know, a majority are first-time renters and often students of color as well. Since the pandemic, we have had a lot of renters that have faced things like illegal lockouts and illegal rent hikes, as well as you know, problems with their landlords and evictions, even though there's an eviction moratorium in place. In my opinion, there's a very direct link and correlation between public health and the right and access to housing. It's a little complex, but you know, basically folks being able to live comfortably and safely directly impacts their ability to live a healthy, happy life. A lot of what we do is providing legal resources to local Westwood renters, as well as informational resources and know your rights. We are currently growing as a union. We have several hundred members, and we're growing. So if you're in the area and you'd like to join us, you can look us up on the LA Tenants Union website. We should have a like a sub-site within that. But yeah, I mean, the fight for housing justice directly overlaps with racial justice, as we heard before from the professor, about who is homeless, what demographics in LA city and county A lot of that starts with who is pushed out of housing, who can afford housing. Here in Westwood Village, we have the most expensive renters market in the state of California, with an average price of a 2-bedroom at around $4,900 a month, which is outrageous considering the constituency are public university college students. So, you know, there's an ever-growing need for renter protections and the right to remain housed. So I will leave it at that, but that's kind of a brief overview of what we do. Again, if you'd like to get involved or learn more, or you need, you know, access to tenant services, I'll drop my email in the chat and feel free to reach out. Thank you.
Thanks, Andrew, and thanks for the LA Tenants Union for being so involved in housing rights. So that concludes all of our speakers today. I think we can all agree that there's a lot of new information that we've learned, and I think it's really important to know all of this in order to take action ourselves as well. So we're going to be moving on to the Q&A. If anyone has any questions, you can feel free to unmute yourselves or drop them in the chat, and we can get to that first. All right, well, while you guys can maybe think about some questions yourselves. Oh, awesome. So Lisa actually put a question in the chat. She asked, if we see someone experiencing homelessness, how can we reach out to them? And if the speakers, you can feel free to unmute yourselves and address the question.
I'll take that one. So if you're not familiar, LA HOP is a resource, it's a portal. And so if you see somebody experiencing homelessness, I think first and foremost, I mean, be kind, you know, and look people in the eye and smile and say hello if you can. But secondly, I think if you do see someone that you would like teams to go out and engage with, you can use LA HOP. I can drop the link in a second into the chat, but it's basically an online portal that you put the location of the person and a description, let's say a man in his 50s, Caucasian, wearing a red turtleneck, whatever it is. And so that way folks can outreach to that person. The team who's responsible for outreach in that area will be deployed. So that would be really effective.
Vicky, can I ask you something? Whenever someone asks me this question, I tell them you should put it on LA HOP or call 211, but I note that the response times on LA HOP are often egregious. And so I tell them to call the SPA lead directly, the service provisionary lead, which in this case would be you. Is that, it would be people concerned.
For Westwood?
For West LA.
For West LA, it's St. Joseph Center.
Oh, it's St. Joseph's. Okay, that's right. It's St. Joseph. So yeah. Is that also a good, now it's going to be recorded forever that I don't know me on SPA lead.
No, that's a great suggestion. That's great. I just feel like sometimes folks, maybe just have time for one or the other, but I think if you can take the time to do the research and especially like find the lead and maybe even for the population that you think it applies for, because there's different organizations, that's incredible. So yes.
Yeah. West of the 405 Venice Family Clinic is also super helpful. Mm-hmm. But we'd love to see quicker response times on LA HOP as well.
Oh, absolutely. Yeah. I know it can take a couple of days. Yeah.
All right. So the next question we have is from Christy. She's asking, what are some past policies that have been able to help people experiencing homelessness?
Well, I think the, go ahead, Randy.
Oh, well, I was just going to say, I mean, I think permanent supportive housing is certainly, or permanent supportive housing is the focus here. and it tends to work, but it also, right, but it also does, nothing works perfectly. And so, you know, I think the approach that, and also a lot of people don't necessarily need this really intensive, because permanent supportive housing includes case management. So a lot of people, in fact, the vast majority of people, need a little bit of help, what we call shallow subsidies, say $300–400 that will help them avoid an immediate crisis. And of course, the natural extension of that is that many people would benefit even more from $300–400 if it came, or eviction prevention assistance if it came before they were evicted or before they lost access to family housing having been evicted, than if it came after their house. But you know, then the other big piece that we're trying to push is what we call progressive engagement, which it means provide someone with the support that you think they need, and then if that doesn't work, provide them with the next thing. So if someone doesn't necessarily need really intensive permanent supportive housing, provide them with a subsidy, but also keep track of them. So if they then fall back into homelessness, or even in permanent supportive housing, right, 5, 6, 7, 8% of people in permanent supportive housing will fall out in any given year, which sounds pretty good, right? That's another way of saying 92% success, but 8% every single year will add up into, in not that many years, the majority will be out of housing. So you need ways to keep track of people when they're in the system and it's not working, but also once they've left the system, so it doesn't take months to know that they're actually homeless again.
Yeah, the only thing I would say is at a policy level, permanent supportive housing had such a terrific track record that basically it drew all the resources away from populations that really didn't need any support. They just needed money. And it may surprise you to know that if you don't have any other source of support in LA County, you qualify for something called general relief. That gives you $221 a month for all your needs, and you get food stamps. None of those people can buy housing with that amount of money. There are almost 100,000 people trying to subsist on that amount, and it hasn't changed since 1983, that amount. So, and in addition to that, over the period of time when we were adding permanent supportive housing, we were actually reducing the number of just walk-in shelters and a little bit better than that. Not that they were solving the problem, but there has been a diversion of resources because in many ways permanent supportive housing succeeded so well.
Thanks for that, Professor Blasi and Dr. Kuhn. So the next question we have is from Lynn, who's asking, what's happening on November 9th? Is the eviction moratorium ending?
So there's confusion about that. There are a lot of eviction moratoriums. The problem is that they don't mean anything if you can still be served with an eviction case with an unlawful detainer. And no unlawful detainers for non-payment of rent have been filed and won't be filed until November the 9th. On that day, the floodgates of evictions for non-payment will open and thousands of evictions will be filed electronically. Landlords are required to file their cases electronically, and soon thousands of people will be served with eviction cases. And if they're unable to respond to those cases when they're served with the paperwork within 5 days, they lose, and they can be evicted within 20 days. So that's what happens on November 9th. The courts are going to start allowing cases to be filed for non-payment of rent.
Thanks, Professor Blasi. All right, so the next question we have in the chat is from Marissa, and they're asking, how do students fight back against illegal eviction? Is it possible without parent or legal support?
Well, the Tenants Union is a good place to start. The LA Tenants Union, and I know in other chapters, has been very effective in providing direct support for people. You can also get some help by going to a website called stayhousedla.org. All small letters, I'll put it in the chat. And that will link you to resources that will, in fact, refer you to something called the Eviction Defense Network. They are now handling all of those cases around the county, and the students are in the same position as any other tenant. They can get a lawyer, they can sue, they can get support from other tenants.
Awesome. Thanks for those resources as well. So the last question that we have in the chat, I think this will be the last one that we're taking right now, is from Rosa, and they're asking, how do you support people after you help them find housing in order to keep them from falling back into homelessness?
Sure. Here, I'm actually going to share my screen real quick one more time. So this is an example of a project-based housing community called Mosaic Gardens at Westlake. It's actually in downtown, not too far from downtown. So once we place somebody into housing, the idea is that on site you have supportive services available. So this whole community is actually for folks who were formerly homeless. And so, so on site they will find volunteer opportunities. They will find opportunities to seek employment, to seek education, to seek whatever else they may need. But I think most importantly, for a lot of people who have been experiencing homelessness for a long time, it's sort of, you know, the ordinary, right? It's the, how do we budget? How do we pay rent? How do I do all of these things that they haven't maybe had to keep track of in a while. And so we ensure that we work with them to ensure that things like rent is paid on time, that they can go to their medical appointments, they can renew their medication. And again, any additional sort of wellness activities, volunteer work, education, employment. And I think to the earlier point, I think it's important to know that people who aren't in PSH are very vulnerable. These are not folks who are going to return to full-time employment. These are folks who are vulnerable and are going to be likely not going to be self-sustaining, I guess, without any additional subsidies. And so, but it doesn't mean that they can't live a fulfilling life. And so that's kind of what the on-site supportive services do.
And I'll just add, you know, I think Vicky's point about having this kind of what we call a service-rich environment, it's a huge deal because we don't just want people to succeed by the measure of staying in housing. We want them to thrive. The trick then is, what are the contexts that what are the ways in which the particular context of PSH is supportive and nurturing, and what are the times in which it's potentially putting people into risk? And so I'll just put a link so there's a big survey a big study that we're starting up that'll actually be, it's funded by the Patient-Centered Outcomes Research Institute, which is the kind of Obamacare funding agency. And it's looking at COVID-related outcomes, but also more broadly patient-centered outcomes in this comparison of what we call single-site PSH, which are the really lovely PSH sites like the one Vicky showed you in the photo, and scattered site, which basically means someone's getting a voucher and going into housing in a wide variety of, you know, just in a neighborhood. And we have a lot of questions about what are the different risks related to this. In particular, you know, a lot of permanent supportive housing projects are in neighborhoods that carry their own, that lack access to employment, lack access to amenities, may have high levels of exposure to other kinds of risks, abuse, danger, police. And so there's a lot that we don't know about how someone can thrive. In particular, if we sort of say there's only so many projects we can build, right? There's say 20, 30,000 people who might need permanent supportive housing, and that number is rising the longer people stay on the streets. And the projects then can't necessarily cover that. So what do we need to do to help someone have the same level of care, the same service, same case management, and the same chance to succeed and thrive that they would have if they're just in a regular apartment with services. And so I encourage, if there are any students who are interested in, say, being involved in a project like this, we'll be enrolling 800 permanent supportive housing clients. And part of that project actually is to give everybody a phone so that we can follow them. And I firmly believe that it's not a panacea, but one thing we need is to bridge the digital divide. That goes for people in supportive housing. That goes for, frankly, people who are currently homeless, half of whom have phones, but half who don't. And of course, people who are at risk of eviction. That one of the big problems here is case managers care they bend over backwards to say, make sure a client can get help before they're thrown out of their board and care or nursing facility, or before they lose access to housing. But it's just hard to keep in contact with them. And so getting people access to phones is one of the coolest parts of this project.
Thanks, Vicki and Dr. Kuhn. That project honestly sounds amazing. So if anyone, I would highly encourage looking into that. I myself will be after this event. So that concludes Sorry, I may be cutting out. Are you all able to hear me? Yeah, okay. My internet's a little bit unstable. So thank you for coming and sharing your expertise. We really appreciate you taking the time to share all this information with us. And we've really been able to learn a lot about the current situation regarding the pandemic and how it's impacting people experiencing homelessness and housing insecurity. Thank you everyone for coming to our event tonight. I hope you enjoyed it and are able to take at least one interesting or new fact away from this event. And you can feel free to message Bruin Shelter on any of our platforms if you have any questions about anything. You can check us out on our website, which is bruinshelter.org. And we are actually also recruiting. So if you want to join our cause, our applications are due tomorrow night. And yeah, Michelle is putting the information in the chat right now. So other than that, I hope you all have a nice rest of your day. We'll be uploading the recording on our YouTube channel and our website after this event. So thank you, everyone.